All right, good afternoon, everyone. Welcome to today's webinar, Protecting Workers, Guidance on Mitigating and Preventing the Spread of COVID-19 in the Workplace. Please go ahead and enter your name and organization in the chat box to help us track attendance. Today's session is being recorded, so to minimize background noise, you have all been placed on mute. If you have questions throughout the webinar, you may enter them in the chat box at any time. I'll be monitoring those as we go along, and we'll get to as many of them as possible at the end of the session. Encompass Michigan has a long-standing partnership with MIOSHA. We have received a fiscal year 2021 Consultation Education and Training Grant Award from MIOSHA, and we are grateful for their support as we continue to provide health and safety training opportunities to community rehabilitation organizations across the state. Supporting our members in maintaining a safe and healthy work environment for staff and persons served is a priority for this association, and we appreciate the opportunity to present today's webinar. I am pleased to welcome our presenter, Augustine Syrovy, Occupational Safety Consultant at MIOSHA. Augustine, the virtual floor is yours.
Okay, thank you. I'm happy to be here. Again, my name is Augustine Syrovy. I am a safety consultant with MIOSHA in the CET division. And of course, today's webinar is Protecting Workers. Just kind of a matter of note, I am a safety consultant, so generally speaking, I don't cover items related to respiratory protection or bloodborne pathogens. Those would be a health consultant. So unfortunately, if you have questions today regarding the need for respiratory protection or bloodborne pathogens, then I would have to refer you to a health consultant. I do, as a safety consultant, do cover COVID-19 related items, and certainly well-versed in the healthcare ETS. So on the screen now, you should see the kind of the title there, Protecting Workers. And of course, this is all about guidance. And today's date of September 16, 2021. And it is, I did check to make sure it was all up to date as of today. Bottom left corner is our contact phone number, and you can find our website at michigan.gov/CET. So some quick notes. Any information or professional opinion included in this presentation is for informational purposes only and does not constitute an official interpretation or communication from the Michigan Occupational Safety and Health Administration. This presentation does not cover President Biden's Path Out of the Pandemic COVID-19 Action Plan. Information has not been released yet from federal OSHA. Until that information is released, I unfortunately can't speak to it or give any opinion or updates as far as what rules may or may not be included. However, official resources for those, you should visit our website at michigan.gov/COVID workplace safety, and then closely monitor osha.gov/coronavirus. And that's where you're going to find the latest information, especially if they update it with President Biden's plan. So just to get started, I kind of wanted to discuss where MIOSHA falls within all of the rules and regulations and guidance. Of course, there's the CDC. Everybody's probably well familiar with that, and everybody here has been to their website and heard all the discussion. They have both guidelines and orders, and they're kind of the overreaching. It's something that MIOSHA has referenced and used since the very beginning. So the CDC, is most well known for their guidance, but also they have orders, airline passengers arriving to the United States, cruise ships, and then they have orders regarding the conveyances and transportation hubs. So through this, they're the ones that put the order in place, for example, for wearing face masks on public transportation. Then there's MDHHS, and they also have orders as well, along with the local public health departments. And I just point that out because that does vary greatly between counties. And certainly a lot of that revolves around schools right now. And while some counties do have requirements and others don't, but make sure that you're staying up to date, of course, on from your local public health department. And then MIOSHA. we have rules. In this case, for COVID, we do have our general duty clause, but we also have emergency rules as well. And the one that may not apply to many of you is going to be the healthcare ETS, the one we directly adopted from federal OSHA. So today's discussion is really going to be focused on MIOSHA's, the guidance that we really have directly referenced from federal OSHA. Other important references, I always like to point out that two standards, MIOSHA General Industry Part 92, Hazard Communication, and MIOSHA General Industry Part 33, Personal Protective Equipment, that those have been in place prior to the pandemic, certainly in place now. Hazard communication and PPE have always been a highly cited rule and something that employers should definitely have in place and pay attention to, and it certainly applies to COVID as well. So we'll discuss that a little bit later and how those standards fit in. And then, like I said before, OSHA has their COVID-19 emergency temporary standard, and that's specific to healthcare right now. In the future, that there may be another one. But today we're going to focus on protecting workers, the OSHA's guidance on mitigating and preventing the spread of COVID-19 in the workplace. So as of right now, this is just guidance. It is not an emergency temporary standard for this information at this point. But that website is down there at osha.gov/coronavirus/safe work. And then just a little reference to the EPA List N, disinfectants for COVID-19, which many are probably aware of. Two of the things I always like to point out is that any of your disinfectants you're using, you're going to want to make sure that you have a SDS for it. You're going to want to have information regarding contact time, and of course, make sure the employees are wearing the proper PPE when they use that. So what's the purpose? So this guidance is designed to help employers protect workers who are unvaccinated, including people who are not fully vaccinated or otherwise at risk, including if they are immunocompromised, and also implement new guidance involving workers who are fully vaccinated but located in areas of substantial or high community transmission. So when OSHA first put out their guidance, there wasn't a lot of information regarding fully vaccinated individuals. It did update it mid-August with some information regarding what they would like to see for people who are fully vaccinated if you're located in those substantial or high community transmission areas, which last time I saw was, for the most part, all of the state of Michigan and most of the country. So this guidance is intended to help employers and workers not covered by OSHA's COVID-19 emergency temporary standard for healthcare. So if you have any operations or buildings or just anything that would be covered under the ETS, you would want to first start there. That is always going to take priority. And then this guidance is going to pick up everywhere else. And that's, of course, that again, just kind of restated, the hope is to protect those that are unvaccinated or otherwise at risk. And then also to provide some protection for workers who are vaccinated, but in those substantial or high risk counties. So the first question we typically get asked, and sometimes it's obvious and sometimes it's not, but is your workplace covered by the COVID-19 ETS for healthcare? And for the most part, like I said, some situations are straightforward. If you work at a hospital, if you work in a nursing home, but sometimes it's not quite so clear. So I'd like to address kind of one of the primary questions I do get from general industry. But to start, is the workplace a setting where an employee provides healthcare services or healthcare support services? So healthcare services mean services that are provided to individuals by professional healthcare practitioners. And those are the ones we usually think about: doctors, nurses, EMTs, somebody going to the eye doctor or a dentist, for the purpose of promoting, maintaining, monitoring, or restoring health. So they typically they're going to have a license and they're going to do something regarding someone's health. It's the healthcare support services that sometimes is a little harder to define or raises more questions. And that means services that facilitate the provision of healthcare services. So does someone support someone else in maintaining their health? Is someone dependent on an employee to assist them so that they can maintain their health? A note in there that vocational settings where healthcare services or healthcare support services are not provided are not covered under the ETS. So one example of a healthcare support service is if you enter someone's home, or if someone requires assistance of an employee to use the bathroom or to bathe or to do other personal hygiene type care. That would be healthcare support services, and that is covered under the ETS. The ETS, however, does not apply to the provision of first aid by an employee who is not a licensed healthcare provider. And that's why I bring it up. This is one of the common questions. I might have employees who are designated as first aid at my facility who would respond to someone who doesn't feel well, whether or not they have COVID symptoms or they fell, or maybe they had a small cut. Does the ETS cover them? And the answer is no. And I'll provide a little bit of information about that. I think it's helpful. This comes from the preamble. So the OSHA healthcare ETS does have a very extensive preamble, and that's where you can find a lot of information about how they came to the conclusion under certain rules, questions that were asked ahead of time, or statements that were made by employers. So from that preamble, this is a specific paragraph. The ETS does not apply to the provision of first aid by an employee who's not a licensed healthcare provider. And again, those are doctors, nurses, EMTs. First aid typically refers to medical attention that is usually administered immediately after injury occurs and at the location where it occurred. So this is very common if somebody gets maybe trips and all they need is a Band-Aid. It often consists of a one-time short treatment, requires relatively little technology or training to administer. So somebody might have a CPR card or a first aid card, but they're not a licensed EMT. First aid might include cleaning minor cuts, scrapes, scratches, treating minor burns, applying bandages or dressings, the use of non-prescription medicine, draining blisters, removing debris from the eye. So there's lots of items listed here. It also includes if you have to perform CPR or rescue breathing. And even if you're providing that support, it's up until the point that medical treatment arrives. So essentially, if you're calling the ambulance, it's until an EMT or the fire department arrives. So those are people providing first aid. OSHA goes on to say that it's regardless of the setting. So and this really applies to kind of an industry setting or even to an educational setting. If you have first aid responders, they're not covered under the ETS, as the ETS does not impose extra healthcare related requirements for employees who are not licensed healthcare providers when they provide first aid. So that's one point I just want to start off with, and because it's the most commonly asked question regarding general industry of what's covered. So getting kind of into the core of today's presentation is what are the roles of employers and workers in responding to COVID-19? Again, this is all really just guidance. There's a few items in here that you're going to want to pay particular attention to. But for the most part, this is all guidance, and it's up to the employer to take this information and implement what they feel is best, would be the best plan for their facility. So the first item, facilitate employees getting vaccinated. That's something that most employers promote. It's well promoted. There's certainly availability, so that's always a priority. And a big one here, and I kind of have it bolded in blue, but instruct any workers who are infected. Unvaccinated workers who had close contact with someone who tested positive for COVID, and then all workers with COVID-19 symptoms to stay home from work. So the two items there in blue, any workers who are infected, that's a critical one. You do not want anyone in your facility that's infected, and you do not want anyone in your facility with symptoms of COVID-19. So those are kind of the two core foundational items that you really have to implement, and those I'll bring up later on regarding what MIOSHA would consider issuing a general duty citation for. Implement physical distancing in all communal work areas for unvaccinated or otherwise at-risk workers. Provide workers with face coverings or surgical masks as appropriate unless their tasks require respirator or other PPE. So this sometimes does, you have to have procedures in place. In some areas, a worker might need different PPE or certainly a respirator depending on the type of work they're doing. Educate and train workers on your COVID-19 policies and procedures using accessible formats and language they understand. And this is really common throughout all of our standards, that it has to be something, they have to be able to access the information, they have to be able to understand the information. We'll just talk a little bit more about that later on. Suggest or require that unvaccinated customers, visitors, or guests wear face coverings in public-facing workplaces, such as retail establishments, that all customers, visitors, or guests wear face coverings in public indoor settings and in areas of substantial or high transmission. And that's fairly common to see those signs, employers asking employee or visitors to wear masks or having their employees wear masks. And that varies kind of greatly between the settings in the county. Maintain a ventilation system, and that's going to be another big point. And the reason why I bold that is because that's an engineering control. That's not something that you have to rely on the employee or a visitor or guest to implement. So a ventilation system, maintaining that and optimizing that is really a kind of a critical component, because it is there and you don't rely on anyone like PPE to utilize. Perform routine cleaning and disinfection. The CDC has great recommendations on when you need to do cleaning and when you need to do disinfection. So I'll be referencing that, and that should be kind of the basis for how you operate. Record and report COVID-19 infections and deaths. There is a requirement to certainly report, there has always been a requirement to report deaths, work-related deaths, and work-related hospitalizations, amputations, or loss of an eye. And COVID-19 is no different. So if you have a work-related hospitalization or death, then you would need to report that to MIOSHA, and we'll have a little discussion about that as well. Implement protections from retaliation and set up an anonymous process for workers to voice concerns about COVID-19 related hazards. So retaliation is something that employees are protected from, and that goes for all other rules as well, not just COVID-19. And then follow other applicable mandatory MIOSHA standards. So there's lots of MIOSHA standards that have been in place, that are still in place, that must be followed. I brought up the two main ones, Part 33, PPE, and then Part 92, which is hazard communications. Those are closely related to COVID-19. But of course, if you are in certain settings, that might also include things like respiratory protection that would have to be built in there. But that's typically more focused on the healthcare setting. So the first item is facilitate employees getting vaccinated. Employers should grant paid time off for employees to get vaccinated and recover from any side effects. And employers should also consider working with local public health authorities to provide vaccinations in their workplace for unvaccinated workers. And we will discuss later on, sometimes there's questions regarding, well, if I provide any vaccines to my employees at work, what if they have a reaction to the vaccine, and do I have to record that as work related? And we'll kind of discuss that later on, whether or not you have to put that information on your log. But for this, the idea is really just to consistently reinforce and promote getting vaccinated and allowing your employees the opportunity to get vaccinated, because as the time goes on, people are still getting vaccinated, and you want to make sure that's still an option for those that are still deciding for themselves. Instruct, and this is really the foundation, is instruct any workers who are infected, unvaccinated workers who've had close contact with someone who has tested positive for COVID, and all workers with COVID-19 symptoms to stay home from work to prevent or reduce the risk of transmission of the virus that causes COVID-19. So any workers who are infected must be excluded from the workplace. All workers with symptoms should be sent home and get tested. And people who have had close contacts, that's the third one, they should be put in quarantine. Now, again, we'll come back to this when we talk about our general duty clause, because the general duty clause will reference essentially having COVID-19 positive workers employees in your workplace and there to be transmission. So that's why I highlighted those two. Is anybody who's infected or who has symptoms, you want to make sure you exclude them for the time being for their isolation period or until they're able to get tested or something from a physician. As recommended by the CDC, fully vaccinated people who have a known exposure to someone suspected or confirmed COVID-19 should get tested 3 to 5 days after exposure and should wear a mask in public indoor settings for 14 days or until they receive a negative test result. So this is something that you just want to stay up to date on the isolation and quarantine instructions from the CDC. It's what MIOSHA uses, and we look to make sure that you were following those requirements. So they have a one nice page information on that. People who are not fully vaccinated should get tested immediately after being identified, and if negative, tested again 5 to 7 days after last exposure, or immediately if symptoms develop during quarantine. So the CDC currently recommends the two tests immediately afterwards, and then 5 to 7 days afterwards to get tested again. Of course, we'd also, you'd want to follow any kind of physician's recommendations as well. And I put on the website, this is one of the, along with the ones I listed initially in the presentation, this is one of the websites that should be kind of bookmarked and on your web address, so you can make sure you visit it often to see if there's updates. They also have information regarding someone who has recovered from COVID-19 within previous 3 months. So you'd want to look to the CDC for that information as well. Now, just be aware that there are requirements within the OSHA's and MIOSHA's directly adopted it, healthcare ETS, that may differ slightly from this. So if you are covered from under the healthcare ETS, you'd want to definitely use those requirements first. Outside of the healthcare ETS, then you would want to go to the CDC and use their quarantine or isolation requirements. Your local county health department might also have recommendations that you would need to follow as well, because they certainly may be more stringent than the CDC. Ensure that the absence policies are non-punitive, and then eliminate or revise policies that encourage workers to come to work sick or when unvaccinated workers have been exposed to COVID-19. So we just want to make sure that our policies and procedures are in line with our expectations, and our hope is that we do not spread COVID-19 in the workplace. Implement physical distancing in all communal work areas for unvaccinated or otherwise at-risk workers. And that's something that was talked about certainly, and a lot of these items were in place, 6 months ago, a year and a half ago. So a lot of this is already have been done. But making sure that you're still mindful of the physical distancing. A key way to protect such workers is to physically distance them from one another, from other workers. Generally, at least 6 feet of distance is recommended, although, and this is important to note, this is not a guarantee of safety, especially in enclosed or poorly ventilated spaces. So we do recognize that the 6 foot rule is not an absolute protection. It's part of that the building block to your overall plan. So if you can get 6 feet of distance, if you can have that increased ventilation, then those are all things that add to it. And that's what the hope is that you select multiple strategies that will all add to a much better overall product and protection for your employees and the general public. At fixed workstations where unvaccinated or otherwise at-risk workers are not able to remain 6 feet away from other people, the transparent shields or other solid barriers can separate these workers from other people. And we've seen those have been common and are certainly in place in most facilities already, having those barriers up. Barriers should block face-to-face pathways between individuals in order to prevent direct transmission of respiratory droplets. And any openings should be placed at the bottom and made as small as possible. And that's fairly consistent, and most employers that I've seen have done a fairly good job at that. The one thing I do find sometimes, especially in the office setting or in a workplace setting, a manufacturing setting where people work out of stations, is to make sure those barriers are based on the height and posture, sitting or standing of the affected workers, directional airflow, and you should always remember that fire safety should be considered. We don't want to put so many barriers up that somebody might impede somebody's fire exit, because we do have a standard that talks about fire exits and maintaining those pathways. And And so when you do install those or design those, keep that in mind, that you'd want to maintain increased ventilation, but you want to provide those barriers in a position that will directly provide protection for those workers if they are sitting or standing or where they're moving around. Provide workers with face coverings or surgical masks as appropriate unless their work tasks require a respirator or other PPE. So, and most employers are doing that. Face coverings are certainly, disposable ones are easy to come by. They're relatively cheap. So they're providing those for their employees to make sure they have those if they choose to wear them, or if the employer is mandating that their employees wear them. In addition to unvaccinated or otherwise at-risk workers, CDC recommends that even fully vaccinated people wear masks in public indoor settings in areas of substantial or high transmission. And notes that fully vaccinated people may appropriately choose to wear masks in public indoor settings, regardless of community level of transmission, particularly if they are at risk or having someone in their household is at risk or not fully vaccinated. So CDC recognizes as MIOSHA that individuals have different preference for wearing a mask. But like the CDC, MIOSHA does certainly recommend that everyone wear a mask in the indoor public setting, because most of Michigan is, if not all of Michigan is in that substantial or high transmission area. Workers should wear a face covering that covers the nose and mouth to contain their wearer's respiratory droplets and to help protect others and potentially themselves. So the face covering is not a PPE item covered under Part 33. It's a form of source control. So that's why it's not a personal protective equipment item, although it does offer some level of protection to the wearer. But we do also recognize there's some tasks where wearing a face covering might increase hazards, or sometimes it's difficult to decide, especially if you're doing different tasks where you need to wear safety glasses and you're constantly having issues with fogging up your safety glasses. So there may be settings where you may have to make a decision based on the hazards present. And certainly that, you'd have to reference Part 33 PPE for when eye protection is required. And we wouldn't want you to remove eye protection if it's required. So maybe you would have to look at employees wearing more goggles, or providing some anti-fog type cleaner, or different type of glasses that may fit them more appropriately. But it sometimes can be difficult to find that combination of safety glasses or goggles and a face covering that would not fog up for employees. It's something that employers have to kind of provide that trial and error with. But many have been very successful. The employer should provide face coverings to workers who request them at no cost, and make the replacements available to workers when they request them. Unless otherwise provided by federal, state, or local requirements, workers who are outdoors may opt not to wear face coverings unless they're at risk, for example, if they're immunocompromised. So generally speaking, not a lot of employers are having their employees wear face coverings outside. It's generally more focused on the indoor environment, but that could vary based on the location and certainly on the employer. But the focus is generally in that indoor space. Educate and train. Educate and train workers on COVID-19 policies and procedures using accessible formats and in language they understand. Train managers on how to implement COVID-19 policies. Probably most of the participants here today have COVID-19 policies. You probably all had them in place for some time now. But it's still important to know that not all managers may remember every part of it. Not all managers may know how to implement each part of your policy or procedure. So reviewing those, we find that employers have many policies and procedures. Some of the major ones like hazard communication or lockout tagout. Employers often have very good policies and procedures set up, but employees over time forget. They forget how to access it. They forget what certain procedures, what they need to do under certain procedures, or maybe a particular manager has never had to implement a certain part of the procedure or policy. So even though we're well into the pandemic, reviewing those items, making sure that each manager knows all components of it, especially the fact that not always you will know who will be there that day. So that's something I bolded and is really important. That goes for all of your safety policies and procedures, and focusing on, like I said, not just COVID-19, but it would be your PPE, it might be your hazard communication, or your lockout tagout. Training should be directed at employees, contractors, and other individuals on site as appropriate, and should include. So notice it's not just employees, it's who enters your site, the contractors as well. Basic facts about COVID-19, including how it spreads and importance of physical distancing, ventilation, vaccination, use of face coverings, hand hygiene. So even discussing what, with your employees, they understand. We have implemented these procedures. We've improved our ventilation. We've installed these types of filters. That's all information you want to share with them. The workplace policy and procedures implemented to protect workers from COVID-19 hazards. So what have you done specifically to protect those employees from COVID-19? And a lot of that is going to revolve around your engineering controls, and you want them to understand why you've put those engineering controls in place so that they hopefully maintain those engineering controls and don't remove any of them. Suggest or require that unvaccinated customers, visitors, or guests wear face coverings in the public-facing workplaces. And this is what I kind of said in the beginning, that a lot of employers have their own policies. Some might require it, some might suggest it, and some simply don't bring it up. This could include posting a notice or otherwise suggesting or requiring that people wear face coverings, even if no longer required by your jurisdiction. And then individuals who are under the age of 2 are actively consuming food or beverages on site need not wear a face covering. Of course, individuals do need to drink and eat. So, setting up if you have a cafeteria or a lunchroom, trying to set it up in a manner knowing that people will be removing their face covering, and allowing employees kind of break time. I think we've all been in positions where I'm sure that people might agree that when you're wearing a face covering, you may not drink as much water as you normally do during the day. And certainly I've experienced this where if you don't drink enough water, you might get a headache, might be dehydrated. So reminding employees to definitely stay hydrated. I know we're kind of winding down on the summer months, but still something important to remind employees, giving them the time or the locations where they can kind of take that mask break in a safe spot, and certainly making sure they stay hydrated, especially if they're doing work that would require additional hydration. Maintain a ventilation system. And this is one of the other big items. The virus that causes COVID-19 spreads between people more readily indoors than outdoors. And improving ventilation is a key engineering control that can be used as part of a layered strategy to reduce the concentration of viral particles in indoor air and the risk of virus transmission to unvaccinated and otherwise at-risk workers in particular. So it is an engineering control, and we really want to push for engineering controls. As I said before, you're not relying on an employee to wear the PPE or to stay 6 feet away from someone. It's there, it's in the setting, and it is part of that layered strategy. We hope that part of your policy and procedures, you're taking components from all these items and implementing them. Not one item is going to be the end all be all to provide the protection. It's implementing this layered strategy. And I definitely recommend that your ventilation system should be one of those priority items. A well-maintained ventilation system is particularly important in an indoor workplace setting. And when working properly, ventilation is an important control measure to limit the spread of COVID-19. Some facilities, it's a little easier than others, depending on the setup of your facility or the age of your facility. So you have to sometimes get creative or implement additional things like portable air cleaners. So key measures include ensuring heating, ventilation, air conditioning systems are operating in accordance with their manufacturer's instructions and design specifications. Often employers have their HVAC systems already on a preventative maintenance schedule. So just maintaining those and making sure that that schedule is up to date and that you are the condition of your equipment, the filters, the performance is all within specs. Conducting all regularly scheduled inspections and maintenance procedures, of course, maximizing the amount of outside air supplied. That's something that for a lot of industrial settings during the summertime, or especially spring, fall, summer, leaving bay doors open is something that they do quite often. But as the winter months approach, then things get closed up tight. Installing air filters with a minimum efficiency reporting value, MERV, of 13 or more are higher when feasible. So that 13 is the rating you're going to be looking for. You know, a lot of people look for that if you're trying to install air filter, change out air filter in your home, then getting that MERV 13 is certainly a good idea. But for the workplace, that's what the minimum we'd recommend. And you can go higher if feasible, and that would be based on your HVAC system, of course. Maximizing natural ventilation in buildings without HVAC systems by opening windows or doors when conditions allow, if that does not pose a safety risk. And what do we mean by safety risk? Well, a lot of overhead bay doors, there's two risks with them being open. One is often there's a fall issue for loading docks. A loading dock, any walking working surface that is 4 feet or more above the lower level, essentially if you could fall 4 feet or more, you have to provide some sort of protection. Often that has to do with a guardrail or a standard barrier, but there's other forms of protection you could utilize. So opening up your overhead bay doors could pose a safety risk if then you have an unprotected edge. So sometimes employers will, if they're going to open up their bay doors and not have a truck and trailer parked there, then they would implement some kind of accordion type guard that they could close, go over the entryway to protect employees. You also have to be careful of employees walking in and out of overhead bay doors, especially if those doors don't have any kind of sensor. That could be a pinch point and be a hazard. So if you do leave bay doors open and employees do enter and exit through those overhead bay doors, we want to make sure you have either a sensor or a constant pressure switch or something that would provide protection for employees that may be underneath the door if it would be closing. And then consider the use of portable air cleaners with HEPA filters in spaces with high occupancy or limited ventilation. So that's why I said you're going to look at your overall system and go for the 13 level or higher, the MERV 13 level. In those areas where you know you might have a little additional difficulty, then installing, purchasing and placing those portable air cleaners, HEPA filter with HEPA filters is going to be a beneficial next step. Perform routine cleaning disinfection. As someone who has been in the facility within 24 hours suspected of having or confirmed to have COVID-19, follow the CDC cleaning disinfection recommendations. So they have great recommendations on their site. They kind of walk through different scenarios. They talk about how to clean. There's references to bleach mixtures, but it is for someone who is suspected of or confirmed to have COVID-19. Follow requirements and mandatory MIOSHA standards for hazard communication and PPE appropriate for exposure to cleaning chemicals. So commonly employers, if you purchase bleach and you want to make your own bleach water solution, anyone who is performing that mixture likely needs goggles and probably a face shield, gloves, maybe an apron, depending on how they're distributing the bleach or adding the bleach to the water or vice versa. So oftentimes there's a PPE requirement, and certainly there's a hazard communication requirement for the SDS and what the hazards are associated with the chemical that you're adding or mixing. Be aware that a bleach water solution mixture does have a limited shelf life. So once you make that mixture, you're going to want to use it within an appropriate period of time. So just make sure you reference those CDC recommendations and whatever you're referencing for doing that mixing solution. Be aware that once you make the solution, you mix it, you may only have a limited 24, 48, maybe 1 week to use that solution before you must discard it, before it's no longer effective. And a common question I'll ask employees, and this goes not just for COVID-19, but this is in the healthcare setting, employees should be well versed in the contact time of a disinfectant. How long does that have to stay on the surface before you wipe it away? Contact times range anywhere from 30 seconds to 10 minutes. And certainly they can vary, anywhere in between. Some can be quite fast, and some take quite like I said, 10 minutes. They must sit on a surface before you should wipe it away. So that's important information to know. Perform cleaning disinfection at facility, another website, the CDC website, and this is taken directly from their website. If less than 24 hours has passed since the person who is sick or diagnosed with COVID-19 has been in the space, clean, disinfect. So you have to do both. If more than 24 hours has passed since the person who is sick or diagnosed with COVID-19 has been in the space, then cleaning is enough. You may choose to disinfect depending on certain conditions or everyday practices required by facilities. So you might say that once a day we're disinfecting no matter what. But if it's less than 24 hours, you must clean and disinfect. If it's more than 24 hours, you only have to clean. However, if it is more than 3 days have passed since the person was sick or diagnosed with COVID-19 has been in the space, there's no additional cleaning needed beyond what your normal cleaning practices. So those are the kind of the 3 timeframes you want to pay attention to, at least if you're following the CDC recommendations, which would recommend is that 24-hour period to clean, disinfect. Between 24 and 3 days, you'll do cleaning, and beyond 3 days, then you'll follow your normal procedures. Record and report. All employers have obligation to record and report COVID-19 infections and deaths that are work-related and result in a recordable case. So I'll try to go over what makes something recordable, and this applies to all injuries or illnesses. Employers are required to record work-related cases of COVID-19 illness on Form 300 log if the following requirements are met. So the case is confirmed case of COVID-19. So this is not suspected, this is confirmed. The case is work-related, meaning that it's based on information you've done in your investigation, that you determined that the individual, the employee did get COVID-19 from work. The case involves one or more relevant recording criteria, medical treatment, days away from work. So often if you have COVID-19, you're going to go into isolation. So you are going to have time off work, realistically, unless you already work remotely, which is possible, and you work through your isolation. But if you receive any kind of medication, certainly if you're admitted to the hospital, but if you, for example, have to isolate and you're not allowed to report to work, then that would be days away from work. Then that would be a requirement. If you normally work in person, but now you're adjusted to an alternate work schedule and work from home, that would be recordable because you have restricted work. So all those things would make something recordable. Again, it has to be a confirmed case, it has to be work related, and it has to involve one or more relevant recording criteria, which would often for COVID-19 be the isolation that requires people not to report to work. Employers must report work-related COVID-19 fatalities and hospitalizations to MIOSHA. So if you do have a work-related COVID-19 and there is a fatality because of it or hospitalization, you need to report that to MIOSHA. Now, this comes directly from our agency instruction, which is available on our website. The MIOSHA's agency instruction on coronavirus disease 2019. COVID-19 interim enforcement plan, and this is for outside of the healthcare settings. Most of this agency instruction focuses on the healthcare setting. Just a small portion focuses on outside the healthcare setting. It says the general duty clause can be used to cite COVID-19 hazards in circumstances where both recordable illness and person-to-person transmission of the virus in the workplace can be documented. So we're going to be looking for, is that recordable, meaning the conditions we just discussed, and there was person-to-person transmission. Did they get it from someone at work or through their interaction at work? Maybe it might have been a customer or visitor that was known to have it. Then if we can document that, then we could explore, MIOSHA may explore using the general duty clause. So that's why I made such a stress of importance that if someone has COVID-19 or someone has COVID-19 symptoms, you do want to absolutely exclude them from workplace. You certainly should be implementing your quarantine protocols as well. We would definitely recommend that. But at minimum, excluding workers who have COVID-19 or who have COVID-19 symptoms for your workplace is absolutely important. So if you're looking to facilitate vaccination of your employees and maybe have that done on site, a question that's often asked is, are adverse reactions to the COVID-19 vaccine recordable on OSHA record keeping log? And this is a great question to ask, because if you do provide vaccines to your employees or require vaccinations, then often those are, if they have adverse reactions, those are recordable. In this case, and this came directly from OSHA's FAQ website, and the website is down there at osha.gov/coronavirus/FAQs. Department of Labor and OSHA, as well as other federal agencies, are working diligently to encourage COVID-19 vaccinations. OSHA does not wish to have any appearance of discouraging workers from receiving COVID-19 vaccinations, and also does not wish to be disincentivize employers' vaccination efforts. As a result, OSHA will not enforce, in what they're referencing, 29 CFR 1904's record keeping requirement, and that's MIOSHA's, it's similar to MIOSHA's record keeping requirement, to require any employer to record worker side effects from COVID-19 vaccinations at least through May 2022. And then it goes on to say, we will reevaluate the agency's position at that time to determine the best course of action moving forward. So you don't have to worry about recording those adverse side effects from the COVID vaccine at least through May 2022. And I highly recommend that everyone here visit OSHA's website and go through those FAQs. There's lots of great information. And certainly as new information gets put in place, gets added to the website, then they'll add more FAQs regarding commonly asked questions. Implement protections from retaliation and set up an anonymous process for workers to voice concerns about COVID-19 related hazards. So protections from retaliation are in place. They've been in place before COVID, so that nothing's changed there. Allowing workers to voice concerns, and that's critical, because concerns certainly can change by the same employee from time to time as the transmission rates increase or decrease, as their exposure to it increases or decreases. So employees who previously may have not had questions or concerns may now have questions and concerns. So making sure you're maintaining those anonymous processes for workers to voice those concerns is still important. Even if we've been in this pandemic for some time, new concerns can arise, or simply if they want to report something not working, or saying that maybe one of your engineering controls is no longer effective. And follow other applicable mandatory MIOSHA standards. So MIOSHA has a list of standards. If you go to michigan.gov/MIOSHA standards, you will see all of our standards. There is general industry standards, there is administrative standards, and there is construction standards. I do recommend that most employers will focus on the general industry standards, but definitely look at the administrative standards, because those are things like record keeping and hazard communications. There's also a few other standards in there as well, but don't forget about construction standards. Facilities commonly have construction taking place at their location. So even though that you're in a general industry setting, it's often that you have construction work being performed. And even your maintenance staff, who normally performs general industry work, may, by installing something new, may now be covered under the construction rules. So that's something to keep in mind, especially when it comes to maintenance, that if they're, for example, installing a brand new HVAC unit, or installing brand new lights throughout your facility, then that would be construction. If they're simply replacing a light bulb or replacing a light like for like, meaning it's the exact same light that was there previously, then that would be general industry. But for the most part, if you're installing something new or building something, that's construction, and you would fall under the construction rules as opposed to general industry. So that is all the information I had today. It took about 50 minutes. So I wanted to leave about 10 minutes for questions if there are any, and I'd be open to those now.
Thank you so much, Augustine. Lots of great, helpful information. Appreciate it. Folks, you can go ahead and enter those questions in the chat, or feel free to unmute yourselves. Just a note that a copy of this recording along with a PDF of the slides will be distributed to anyone who registered for the event. So all of those great links that he shared throughout the presentation, you will be able to see what those are and go back and visit those. Does anybody have any questions at this time? Okay, I do have one that popped up. Because we do not know what people do away from work, how would we know if indeed a case of COVID is work-related? Maybe they got it at the bar they go to after work.
Yeah, that's a great question. So it can be difficult. In the healthcare setting, of course, then it's someone who regularly works with COVID the patients, or may take care of people with COVID symptoms. Then it's assumed for the most part, at least initially, that it was through work. But outside the healthcare setting, so you're in the general industry setting and not covered by the healthcare ETS, then you're right. It can be difficult because transmission is so high in all of the state of Michigan. It is something that you can initially consider. You can assume that it's probably not work-related unless proven otherwise. So you do want to do an investigation, and you would want to look for things like multiple coworkers having symptoms, more than one person working in the same area being off work at the same time. You're going to basically look for kind of multiples. If only one worker has COVID symptoms, and no one else around them has symptoms at a similar time, it's not spreading through your workplace, then it's something it'd probably be fairly safe to assume that it was not work-related and not recordable, therefore. But as soon as you have one employee out for COVID symptoms, and then immediately following another employee and another employee, as it starts, you're building in the same area, someone who's had close contact with someone, then you would have to start looking more closely at is that it might be work related. And then if you can't determine that person, got COVID from a close family member or someone else, then it might very well be work related at that point. So now I don't have, unfortunately, a clear-cut flow chart for you, or something that could kind of definitively tell you this is what would be the defining factor. It would be heavily reliant on that. Once you have an initial confirmation of one employee who has COVID, if anyone around them that worked within close proximity to that person developed COVID immediately following their interaction, that's when you'd probably want to look at that.
Great, thank you so much. One other thing that popped up, so you noted employers should grant paid time off for employees to get vaccinated and recover from any side effects. Any thoughts on this for the upcoming potential boosters as well?
Yeah, and just to be clear, at this point, this is all guidance. So none of this is, of course, requirements. Some items, some of these items are implementing these items is going to definitely keep your workers safe or safer, and hopefully prevent COVID-19 from spreading in the workplace. But most of these items are not absolutely required, because we're looking for very specific things regarding general duty clause. So regarding the vaccination or boosters, it's going to be something that certainly, if CDC, as CDC makes recommendations, as OSHA makes recommendations, we're gonna follow those as well. So it would be something, I think it would be the best practice, but it's not currently, because it's not. I didn't include in this presentation because it's not currently part of OSHA's guidance at this point, but would be a best practice to, as booster shots become available to individuals, or are recommended by a physician, allowing that time off would be the best practice.
Great, thank you. Any other questions for Augustine today? All right, I don't see any others arising. So thank you again. Great session. Lots of really important information. Appreciate your time in sharing with us today. And thank you all for joining us. I hope you have a great afternoon. Oh, did something pop up in the chat? Sorry. Nope, just a thank you. Thank you, thank you, thank you, Augustine. All right, appreciate it. Have a great afternoon, everyone.
Bye.